Hello everyone, my name is Nafisa Chowdhury. I am a fourth year medical student at the Dr. Kiran C. Patel College of Allopathic Medicine. This is a poster on the suicide rates in the South Florida Tri-County area, which is an investigation of the effects of the COVID-19 pandemic on mental health and well-being. As the COVID-19 pandemic began to escalate during the summer of 2020, the CDC documented a distinctive increase in the percentage of U.S. adults who reported having suicidal thoughts from a baseline of 4.3% in 2019 to 10.7% in 2020. As the pandemic continued and the year dragged on, there was a lot of speculation that suicide rates would follow. And early studies abroad identified countries with large increases in suicide rates, including Japan. In Florida, public health officials were concerned, and many pre-established interventions received increased funding and support. The purpose of this study was to investigate if the Tri-County area, including Miami-Dade, Broward, and Palm Beach counties, did actually have an increased rate of suicides during the year 2020 as projected. In this cohort study, we assembled suicide death data supplied by the Florida Department of Health Bureau of Vital Statistics from the years 2011 until 2020. Data was adjusted for changes in the annual population. Cochrane-Armitage test of linear trends was used to assess the trend line for annual suicide incidents in the state of Florida and the Tri-County area of Broward, Palm Beach, and Miami-Dade counties. Furthermore, trend line from 2011 to 2019 was compared to 2011 to 2020. This would help us understand if the projected 2020 suicide rate based on the previous years was any different from the addition of 2020 data. From 2011 to 2020, there was no trend found in the incidence of suicides per capita, as that can be seen in Table 1 and Figure 1. Excluding 2020 data to estimate trend prior to 2020, the incidence of suicide per capita from 2011 to 2019 in state of Florida showed an upward trend of 0.03 per year, or 3 per 100,000. Therefore, data in 2020 deviated away from the trend to the extent that there was no significant trend with the inclusion of 2020. As for the included counties, this is visualized in Figure 2. None of the counties had any difference in trend from 2011 to 2019 versus 2011 to 2020. According to our data analysis, there was a decrease in annual suicide rates in the Tri-County area, including Broward, Palm Beach, and Miami-Dade counties from 2019 to 2020, as shown in Figure 1. Furthermore, there was no increase in the trend as predicted earlier in the year. This can be seen in Figure 2. We have a number of possible hypotheses for these results. The first is with regards to telehealth. Telehealth improves access to care for patients with transportation uncertainty, time constraints, and financial difficulties. In Broward County, calls to the 211 helpline showed a 118% increase in mental health related calls and an 86% increase in suicide related calls. Another possible influencing factor could be the stay-at-home orders that went into effect at the beginning of the pandemic. These stay-at-home orders and business closures allowed for increased family time for many Americans and may have had increased protective effects for those at risk of suicide. Another effect may have been the less restrictive social distancing guidelines in the state of Florida, which allowed residents to go outdoors early in the pandemic compared to other areas in the United States. Protective factors which may have affected the Florida Tri-County area specifically is the negative association of physical activity and suicidality and the green environment that makes up most of the county. Thank you, and if you have any questions or comments regarding this, feel free to contact me for future directions and references. Please scan the QR code. Thank you.